All right. Hi, everybody. Welcome to Webinar Wednesday. It might look different to those of you that regularly attend. I'm in the office today, so not at home, but still working. We hold these webinars every other Wednesday from 1:30 to 3. They are archived and recorded, and your CEU request will be up usually by the end of the workday tomorrow, along with the recording, so you can make your requests after viewing or share with others to watch later too. We do have these scheduled all the way through July, and I just scheduled one into August. So keep coming throughout the summer. We'll still be here. But yeah, we're very excited to have this group with us today. We have Tamim Saidi was born in Afghanistan. As a teenager, he was forced to leave his family behind and flee to Pakistan as a refugee. He came to the US in 1990 and has called Minnesota home ever since. In 2018, he was selected as one of 24 Bush Fellows out of 751 highly qualified candidates from Minnesota, North Dakota, South Dakota, and 23 Native nations as exceptional leaders who have made the most of the opportunities in their lives. He received his Doctor of Pharmacy degree from the University of Minnesota and currently works as a consultant pharmacist. He has completed a 2-year multi-religious fellowship program with the Collegeville Institute. He has served in many community activities, and I'm not going to read that whole list to me, but it's an impressive list. If you want it, I can email it out to you guys later. But he's currently pursuing his master's degree in Islamic Studies and Leadership from Bateman Claremont School of Theology. He has spoken and presented to thousands of Minnesotans about Islam and Muslims as culture and way of life. Some of his articles and op-eds have appeared at Engage Minnesota, Star Tribune, Pioneer Press, USA Today, St. Cloud Times, and Minnesota Daily. He has also appeared on WCCO and TPTV Almanac. He was featured in Speaking of Home on Minnesota Immigrants in downtown St. Paul. He has been serving as a volunteer imam, excuse me, delivering weekly Friday sermons at multiple local mosques in the Twin Cities. He is a husband, son, brother, and father of 4 children. So thank you very much for taking the time to present to us today. We're excited to.
Sure, thank you very much. Thanks for having us here today, and thanks for organizing this. It's really an honor to be with you. It's hard for me to know exactly where the audience interests are or where they are. So what I'm going to do is I'm going to do an overall general presentation. We can stop at about 10 minutes or so. Then you can ask questions and let me know if you have questions or what else which kind of questions we can answer for you. With that, I'm going to start with an Islamic greeting that says Assalamu alaikum, which means peace be with you or peace be upon you. The reply to that is wa alaikum assalam, which means that may peace be with you also. So for those of you who might have some Muslim clients or Muslim patients, this is a good greeting to memorize. So it says Assalamu alaikum, which really means, I remember my dad, when he first came here, I think about in 2002, I believe he came here, and he was very sick. So he visited a number of providers, and he was in a transitional care units and hospitals, and saw many doctors and providers. And from amongst them, I think a couple of them greeted him when they knew he was a Muslim. They greeted him with this greeting, Assalamu alaikum, which really meant a lot to my father. So this could mean a lot to your clients, your patients, for you to be able to connect with them and show them that you care for them and you respect them. So it means a lot to them. So this is something good to keep in mind if you can. So say it's Assalamu alaikum, peace be upon you. So again, this is an IRG presentation. The goal of IRG is to build bridges of understanding between Muslims and the broader community through education. So we hope that we will be able to do this with this presentation as well. The objective of this presentation is to gain some basic knowledge about the Muslim population, locally, nationally, and worldwide, get a basic understanding of Muslims' culture and how it impacts their care, and also get an awareness of Muslims' positions on some of the healthcare related issues. We'll briefly talk about, I don't know if we have many people from hospitals, fields, and so on. We'll talk about some of those, but we'll talk about generally other issues also, and how to interact with Muslim patients, what to be aware of, and so on. With that, quickly an outline, we'll talk about a few cases. We'll offer some definitions, terminology, demographics, an overview, a very brief overview of Islamic beliefs and practices, some tips for interacting for Muslim patients and their families. So hopefully the benefits of this and other cultural education would be to have an improved compliance with your clients, with your patients, enhanced decision-making, improved outcomes, increased rate of successful and preventative measures, and also a good relationship with your patients and their families. So we hope that we can do this through this presentation. We'll just do, what I'm going to do right now is I'm going to mention a few cases briefly. Then we'll do the presentation, and then we'll touch base with them back towards the end of the presentation. I think by then you would know a lot about these cases. The first case was from one of the Twin Cities neonatologists who called us and asked, said, well, they have been using this porcine, basically like pork-based surfactant in the lung of newborn premature neonates generally, but he was told that this is not appropriate to use for his Muslim patients. And he was wondering what could be done about this, because this product had shown to have a lower mortality rate than comparative bovine products, or basically beef-based products. So we'll talk about this as one of the cases. The second case was in the Children's Hospital also, that a resident was trying to enter the room of a Somali pediatric patient. She opened the door, she knocked and opened the door, and there was a resistance behind the door. She couldn't get the door to open. She was really worried about what's going on behind the door. She ran to the desk, she got a hug, she got the nurse manager. They all went to the patient's room, and the door was open, and the family was sitting there, and they were wondering what's going on, what was happening. The next case is an elderly female immigrant from East Asia. She was seen at the clinic a few days ago with an infection, upper respiratory infection, had a high fever and a lot of symptoms. She comes back to the clinic. She is not able to speak English, and her 12-year-old grandson comes along with her and to interpret for her. When she was questioned, she said that she stopped taking the antibiotics after a couple of doses. She has missed a couple of appointments, and she refuses to take her cough syrup. So this is, we'll talk about this also. The last case was in a 41-year-old African American with diabetes. She was admitted to the ER with severe hypoglycemia. Last year, she was diagnosed with diabetes. She was put on an insulin regimen, 2 different insulin regimens, and then she was having severe hypoglycemia. She comes to the ER, and then when she is a little bit more conscious, she refuses to change into the hospital gown. She refuses to be examined by the male nurses that are on staff that day, and ER is very busy, and they don't have any female nurses available. So we'll talk about this case also. So those are like 4 cases generally. So we'll talk about some terminology and demographics. Islam, you're gonna hear me say it with a soft S and not a Z. So Islam in Arabic comes from 2 different root words. One is salam, which means peace. The other one is taslama, which means submission to God. So for Muslims, Islam means submission, peace through submission to God's will. And for practicing Muslims, Islam is not just a belief, it's a way of life, on how practicing Muslims live their lives on regular day-to-day basis, essentially every day, from the time that somebody is born until somebody dies. So this is a way of life for practicing Muslims. And also, you're going to hear me say Muslim instead of Muslim. Muslim, Islam meant submission to God. Muslim means the one who submits to God, the one who submits to the will of God. And this picture kind of shows a picture of the diverse Muslim population. And one of the things that I hope you will get from this presentation is that the Muslim community is not a monolithic community. It's a very diverse community. It's diverse in many ways, and ethnically, racially, based on education levels, based on income, and every level, there are Muslims basically in all throughout the spectrum, which is true for people of all faiths, all religions, all backgrounds. And we'll talk about this. There are about 2 billion, almost 2 billion Muslims around the world, which obviously that by itself would tell us that it's going to be a very diverse population. So there are 1.8, this is a few years old, but I think it's probably going to be close to 2 billion now, which Muslims make up close to a quarter of the world population. That little diagram in the bottom shows you the percentages of Muslim population in each one of these countries. There are Muslims throughout the world, and actually most of the Muslims do not live in the Middle East. Most of the Muslims live in South and Southeast Asia, mostly with India, Pakistan, Bangladesh, and then also if you were to add Indonesia and Malaysia, that's where most of the Muslims in the world live in. And this slide quickly shows the top 20 Muslim countries. Indonesia is the most populous Muslim country in the world with over 200 million population. Followed by Pakistan, about 175 million, closely followed by Muslims in India, close to Pakistan, and then Bangladesh, and then followed by Egypt and then other countries. So these are, and then you can actually see, these are the top few countries. Just a quick note is that sometimes in some of the talk shows or some places, people equate Muslims with Arabs. The majority of Muslims are not Arabs. They come from different ethnic backgrounds. Arabs are a very significant part of the Muslim population. Islam started within Arab Muslims in Saudi Arabia, which was what is today Saudi Arabia, where the Prophet Muhammad was from. The early generations of Muslims were Arabs, the majority of them. But population-wise, numbers-wise, Arabs make up less than a fifth of the Muslim population. And then Muslims come from all other ethnic backgrounds. Just a quickly to note that also.
Hey, Tamim.
Yeah.
So just to provide a little local flavor as well. So I was lucky enough. I visited Grand Forks and East Grand Forks several times before, of course, COVID restrictions. And so it looks like in the region up there, it looks like, it's largely, like you said, most Muslims aren't Arabs, but I believe the population locally up there is going to be largely Arabs, I believe from Iraq, if memory serves. And then we also have a large Somali population up there as well. So those are the two main Muslim communities I suspect people will be dealing with up there.
Sure. Thank you, John. Yeah, that's really important to know. Yeah, I would not be aware of your local statistics. So thanks, John. That's good to know. So quickly about Islam in America, there are some historical records that show that at least a third of those who were enslaved and brought to America in 18th and 19th century were African Muslims. So Muslims have been here for a long time, including a number of Caucasians who are Muslims, even at the time of Thomas Jefferson, who appointed some to become like ambassadors in different parts of the world. There's a growing number of American-born Muslims. Based on the most recent data, the numbers are about close to 3.5 million. 1.1% of the overall population. There are about 5,000 Muslims in the U.S. Army. In Minnesota, we have about 160,000 Muslims, at least close to 200,000 Muslims in Minnesota. I don't know any specific numbers for your region, but that's what we have here in Minnesota. Also in Minnesota, our estimates are that like 3/4 of our population are from African background, Somalis, other Africans, and then a good significant African-American population, Arab population, and South Asian population. These are not exact numbers. These are what the estimates we had. Also, quickly, some of the people that, at least in our region, we know who are well known as Representative Congresswoman Ilhan Omar, Attorney General Keith Ellison, some of the NBA players, NFL players, and then also some athletes, Amaya Zafar, who's a local boxer, Halima Aden, who was Miss Minnesota, contested in some of the beauty pageants recently. She left that. So a lot of local people that we know here in Minnesota. We should have found some for your local area, which I don't, so sorry about that. Let's just take some questions quickly before we talk about religion versus culture. And you can also type your questions in Carly can read them out or John can read them out to me also. Any questions about demographics, statistics, terminology?
To me, maybe I'll just jump in with a brief comment.
Sure.
You know, I think in terms of, again, the local demographics, I know there's, to the best of my knowledge, and this is based on my memory from visiting the mosques a couple of years ago, on the Minnesota side, East Grand Forks, there's a wonderful, mostly Somali mosque over there. Masjid al-Hudda is the name of it. Abdul Razak is the imam. The imam is the leader of the mosque. Right. So if you're ever looking to connect with like the local Muslim leadership, again, if you know, especially in terms of or in connection with your relationships with patients or clients, the imam of the mosque in East Grand Forks, his name is Abdul Razak, and he's very, very approachable. He's a really outgoing, delightful guy to deal with. And that again, that's a majority Somali community on that side. And then I believe on the North Dakota side, Grand Forks is mostly an Arab mosque. I'm not as well connected with them as with the other folks, but like I said, that's kind of, you know, how the community is organized up in that region.
Okay, great. Anybody else? Any questions?
Is this a good time to ask a question? We got a question in the chat there.
Sure, go ahead, Carl.
Okay, so someone's wondering, what is the difference between the term Muslim and Islam?
Okay, excellent. Islam is the name of the religion, and Muslims are the people who follow and believe in the religion. So just like, you know, if you were to say Christianity is the name of the religion and Christians are the people. So in this case, Islam is the name of the religion and Muslims are the people who follow and believe in the religion. Any other questions?
So I have a question. It's similar to like Judaism. You can have Judaism as like the religion, but also like Judaism is like the culture for people that are like not followers of the religion, but still see themselves as part of like the Jewish community and part of that ethnicity. Is that similar with like Muslim and Islam?
So Islam is in that case, because Muslims come from so many different ethnic and national and ethnic backgrounds, they all have their own cultures, their own practices. Islam is considered to be specifically the religion part of it and how people believe and practice the religious part of it. And I was just going to talk about, maybe we can talk about as we talk about the Islam religion versus culture, is that for most of the Muslim communities around the world, they have Islam as their religion and they have their cultural practices. And they are very much, the religion and culture are very much interwoven with each other, which, you know, religion is part of the culture, culture is part of the religion. And it's kind of hard at times for a lot of people, you know, when people have been practicing living in a culture, they have a hard time distinguishing what is religion and what is culture. So definitely part of it. Now, this is not to say that there are a lot of Muslims who are just culturally Muslims and not very practicing Muslims. I think that is true also. But, you know, I think the basic, probably the most basic definition of a Muslim is someone who believes, and we'll talk about it briefly later on, is that somebody who believes there is no God but God, the one God, the creator of the universe, and that Prophet Muhammad is the last prophet of God. So as long as they believe in that, generally they're considered to be Muslims. And then there are a lot of people who, you know, there are a lot of cultural Muslims, a lot of Muslims who would not, that they would not practice beyond that. There are some Muslims who, you know, Islam is extremely important for them. They practice, they live Islam. Islam is their way of life on regular day-to-day basis. But nonetheless, cultures are different for people. Just like, you know, a few days ago, I was talking to a Catholic school, and I told them that if you were to imagine a Catholic family in, let's say, North Dakota or South Dakota or Minnesota, and a Catholic family in South America, a Catholic family in Italy, a Catholic family, let's say, in Nigeria, and a Catholic family in, let's say, Vietnam, right? Even though they all have the same religion, their cultures are different. How they dress is different, how they speak is different, which kind of food and cuisines they make that's different, which kind of spices they use is different, which kind of perfumes and colognes or all the other things they use is different, and even how they design their mosques is going to be different. So Islam is a basic general religious practices of what to believe, how to practice, and then culture is how else people have done that. And a lot of times for a lot of Muslim parts of the world, a lot of cultural practices are in accordance to Islam, but there are instances that some cultural practices in certain parts of the world are not in accordance to Islam. Sometimes they even happen to be against the teachings of Islam. So religion and culture, even though they are two very important aspects of people's lives, they are not necessarily always the same. They do overlap. Usually religion influences how people practice their culture. The culture influences how they practice their religion, but they are not necessarily the same. So Muslims coming from different backgrounds will have different cultures. And just quickly to give you a quick idea about this picture is from one of our friends from IRG, Safiya and Kamal. Safiya is from Germany. She's a Muslim convert. She converted to Islam in Germany. Kamal is from Turkey. They met in Germany. They got married. They came to the US. Their daughter, Nasreen, she was born and raised here in Minnesota. And then Nasreen married Muhammad, whose parents are from Sudan, right? So even though, and their wedding actually, I think, was a really good mixture of culture and religion. They had a lot of culture, they had Turkish, German, Sudanese cultural practices, and even American practices as part of their wedding. But it was very much within the realm and framework of Islam. Just to emphasize, culture is different than religion, and they're not necessarily the same, but sometimes they can influence each other. Does it help? John, do you want to add anything? I hope I'm not making this more complicated than it is.
No, I think you put it well, and I think to, I guess, maybe address the original question. In my experience, you wouldn't kind of there are Jews who are secular, right? I think in the Muslim tradition, you wouldn't have secular Muslims, right? That would kind of be a contradiction. Like Tamim was saying, being Muslim really fundamentally is the belief, right? The belief, like Tamim said, in God and the Prophet Muhammad. So it wouldn't really make sense in the Muslim tradition to have a secular Muslim in the same sense that we might have Jews who, are secular Jews or don't practice their faith, right? Maybe just to clarify that a little bit, but I think Tamim, you covered everything very well.
Okay. Any other clarifying questions so far? Okay. We'll quickly talk about what do Muslims believe in. Muslims believe in the one God, which in Arabic is called Allah. I think we'll talk about that briefly. The angels from God, the prophets that God had sent, including Abraham, Moses, Jesus, and Muhammad, peace be upon them all. The holy books that God had sent. Muslims consider the Quran, it's called Quran, by the way, or Quran, as the last revelation. Before that, Muslims believe in the Torah, the Psalms, and the Gospel giving to Jesus, peace be upon him. Muslims believe in a day of judgment, and of course the hereafter. And Muslims believe in a divine decree from God. So these are the 6 main beliefs for Muslims. Allah is an Arabic name for God. It's not only Muslims who call, Arab Muslims who call God Allah, but also Christian Arabs call God Allah. And if you were to read the Arabic Bibles, when it says God in English, actually says Allah in Arabic. So when Muslims say Allah, they're talking about the one God, the creator of the universe, the one God who created Adam and Eve, the one God who saved Noah and his family in the flood, the one God, the God of Abraham, the one God who sent the Torah to Moses, and the one God, the God that Jesus worshiped. So when Muslims say Allah, that's the one God, the God that they are talking about. And also Muslims believe, and they know about God, Muslims believe that among the things that we know about God is through the 99 names or attributes of God. Some of those attributes are like God is infinitely loving, infinitely compassionate, infinitely forgiving, infinitely just, all-knowing, all-seeing, all-hearing. And also Muslims believe God is the one who cures, that cure comes from God. God is the one who gives life. God is the one who determines death. And God is the one who protects. So Muslims believe that life, death, and everything in between is from God. And then especially when there are challenges or difficulties or illnesses, if they are sick themselves or their families, for practicing Muslims, they would always go back and plead to God and pray to God for cure and for life and for comfort and all those other things. And Muslims would only, practicing Muslims would only pray to God. They would not pray to the angels. They would not pray to the prophets. They would only pray to God, because God is the one who provides and He does all of these. The Quran is considered to be, as I mentioned earlier, is considered to be the last revelation in Islam, because Muslims believe in previous revelations. It has a great significance in Muslims' lives. Muslims have a lot of respect for the Quran. Muslims believe the Quran to be the last and the unchanged revelation of God. Muslims have a lot of respect for the Quran. They would not put it on the floor. They would not, if it's on a book, something, they would not put anything on top of it. Muslims are generally encouraged to read and to be connected to the Quran on a regular basis. Muslims believe that the Quran contains some verses through which God would provide cure for them. And a lot of people would, especially if they're sick or they're ill or they have challenges, they would read the Quran and they would also listen to the Quran. And I don't know if I can I think we can click here. Is it okay if I play this? You can listen how the Quran is recited.
Yeah, of course. Yeah, go ahead.
We're not able to hear it, Tamim.
You're not able to hear it? Oh. Now I think let's see.
There's a setting down there somewhere to share your computer's audio. I just don't know.
Yeah. Can you hear it now?
There you go. Now we can.
That's good. That's good.
بسم الله الرحمن الرحيم الحمد لله رب العالمين الرحمن الرحيم مالك يوم الدين إياك نعبد وإياك نستعين اهدنا الصراط المستقيم صراط الذين أنعمت عليهم غير المغضوب عليهم ولا الضالين.
So that is the first chapter in the Quran known as the opening chapter or the opener chapter, Surah Al-Fatiha, which is actually considered to be the verses of cure, one of the verses which actually helps people to be cured, which is a beautiful recitation. If I get a chance, depending on time, I can translate also for you. So the Quran is considered to be the last revelation from God. We'll talk about this quickly, then I'll take some more questions. The five, what are called the five pillars or five main practices for Muslims are, the first one is declaration of faith, which is basically declaring that there is no God but God, there is no other deity worthy of worship but the one God, and that Muhammad is the last messenger of God. And then the second one are the 5 daily prayers. We'll talk about those, I think, briefly. The next one is the mandatory alms, that Muslims who are wealthy enough, they're supposed to give at least 2.5% of their wealth to the poor. And then the next one is the fasting during the month of Ramadan, which we just finished recently. And then the last one is the pilgrimage, which Muslims are told to make a pilgrimage once in a lifetime if they can afford it monetarily, financially, and physically. So these are the 5 main pillars in Islam, or 5 main practices in Islam. The first pillar, as I mentioned earlier, says that there is no deity, there is no God but the one God. There's no small g God but God, and that Muhammad is the messenger of God. A lot of times Muslims would add that Muhammad is the messenger and the servant of God, because that would signify for Muslims that only God is worthy of worship and that Muhammad is not worthy of worship. And this is a significant part for Muslims, is that that believing in by both parts, God and then Muhammad as the last messenger, would make somebody to be a Muslim at the basic level. Believing in God and Prophet Muhammad. And also this would be a statement that when somebody is dying at a deathbed, the family or friends or the imam or the basically clergy who's present would encourage the person to say it if they are able to, of course, if they are not in coma or things. They say the person, so the last statement from them would be that there is no God but God, and that Muhammad is the last messenger and the servant of God. So I'll just stop here for a minute. Let's take some quick questions about this so far. So I cannot see the chat box if you guys are typing anything in the chat.
Right,
So,
there's nothing in the chat right now. If you guys want to type in chat, or you can just unmute yourselves and talk,
sure, yeah.
whichever way you want to ask a question, you're more than welcome.
Okay, I guess no questions. I think I'm doing such a good job. I'm not leaving any
Yes,
questions unanswered.
yep, exactly.
So, okay, that's great. That's fine. But, by the way, feel free to ask questions. I think, I really consider the questions to be the best part of the presentation. So if you have any questions, don't feel
Someone did
shy.
ask if your slides will be available after the presentation.
John, can we share the PDF of the slides? John is the boss, so I'm going to defer it to John.
Yeah, absolutely. We'll just make like a PDF, a small size PDF that we can share with you guys through email.
Thank you.
Okay, great. Okay, wonderful. So the next pillar is the prayers, practicing Muslims. And of course, I should probably just mention that just like people of all faiths, if they're Christians, Muslims, Catholics, Jews, Buddhists, Hindus, not every Muslim is a practicing Muslim. But for practicing Muslims, the second most important pillar after believing in God is the 5 daily prayers that Muslims pray 5 times a day. The first prayer is before the sunrise, a little bit past noon, mid-afternoon, after the sunset, and at night. So practicing Muslims pray 5 times a day. And of course, there's some exceptions if they're traveling, if they're sick, or other things happening. There's a lot of room and leeway for difficulties for people. Before the prayer, there's a ritual of washing, like an ablution, to purify oneself when they pray, because Muslims believe that when they pray that they are speaking with God. So they want to be clean when they want to be in state of purity and cleanliness when they pray to God. And that purity would not only apply to the body, but to the clothes, as well as to the place of prayer. So when they pray, they want to make sure to have a clean area to pray. And Muslims essentially can pray anywhere except for the bathrooms. And of course, they're not supposed to block the highways or walkways and things like that. But outside, any area which is clean, they can pray as long as they're not blocking people other than bathrooms. And also, ritual of ablution, by the way, includes like washing the hands, rinsing them out, the face, wiping over the head, the hands to the elbow, and also the feet, if they will wash their feet if they're at home or a mosque. If they're outside, they can also wipe over their socks or wipe over the shoes also if they're outside. Fridays are the day of congregation, like Sabbath for Muslims, the day of prayer and congregation for Muslims. And when Muslims are praying, they would face, generally as a community, they would face towards northeast. I should say, in the North America will be northeast, facing towards the house in Kaaba, which is in the city of Mecca, in today's Saudi Arabia. Some people from all over the world would just face towards one direction. This is like a focal point for Muslims from all over the world to focus and pray towards the one area and one direction. As a way of unity, and also symbolic that there's only one God. And also when Muslims are praying, they're in a complete state of meditation and concentration. They would not speak to people unless there's an emergency. If there's an emergency, they have to respond to something, they can break the prayer, then they have to restart the prayer. So usually if you have people, like when my dad was in the TCU units, he would be sitting down and praying, he would put a little sign saying that praying, please do not interrupt. So if the nursing assistants or nurses would come and visit him, they knew that he was praying. It's not like he was not responding to something. So he knew that he was praying. The prayers are done like this, actually starting from top left, is that they would start with standing up and saying Allahu Akbar, which means God is great. Allah means God, Akbar means great, or literally greater. God is the greatest, God is greater. They would close their hands, and second middle picture, they would close their hands and recite the first chapter in the Quran, the one that we just listened earlier, in Arabic, and they would recite some other verses. they would say Allahu Akbar, God is great. They would bow down and then say Subhana Rabbi al-Azim, which means glorified be the great God, glorified be the great God 3 times. They would stand up and they would bow down on the ground. They would prostrate on the ground. Just like it's mentioned, by the way, in the Bible, that Jesus, peace be upon him, prostrated to God, and David and Moses and other figures. And while they're prostrating, they would say, glorified be Subhana Rabbi al-A'la, glorified be the most exalted God, glorified the most exalted God. They would sit down and then do a second prostration, and this would be considered to be one cycle of the prayer. The prayers are generally 2, 3, or 4 cycles, and it usually takes about like a minute to 2 minutes per cycle. So even though Muslims would pray 5 times a day, each prayer is generally about 5 to 10 minutes maybe, so it's not that long of a time. So that's, that doesn't take too long to do this. And usually people, for the co-workers or colleagues who are Muslims, they might just take about a 10-minute quick break to go and do their prayers. So questions? Yeah, go ahead, John.
Yeah, we do have a question in the chat. Ali's asking, is it true that you shouldn't walk in front of someone who's praying?
Yes, and generally Muslims will try to find somewhere close, that they're close to a wall that they're praying. But if you see somebody's praying, you should not walk in front of them unless you're like, further away by a few feet, by a few yards, and that's probably okay. But generally Muslims would either pray close to a wall, or they would put like a chair or something or whatever they can in front of them so people can cross on the other side of that. But yes, thank you, very good question. So it's best not to walk in front of the people when they're praying. Excellent question, thank you. Other questions? No? Good. So this is just a mosque literally means a place of prostration, or like a mosque is kind of like a equivalent to what the church is for Christians, mosque is for Muslims. This literally means a place of prostration. And Muslims can pray at the chapels. A lot of hospitals and places have a chapel, like a prayer meditation room. If not, a conference room. I think the picture on the left is one of the healthcare workers, one of the nurses praying in a conference room. So a lot of hospitals have chapels, very nice chapels. They usually have a prayer rug for Muslims that they can pray on. They would leave some copies of the Quran and so on. So those are very helpful things to have in your community if possible. They usually have like a multi-faith meditation room, so people of any faith can go and practice. They will have some things for people to help them to for their worships, like chapels and things like that. So the 5 daily prayers, I think we talked about it earlier. We talked about a direction of the prayer, which is northeast. And I remember in the older days, before we had all the iPhones and all these smartphones, I would be at a place, I would go to a nursing home, work at a nursing home, and I would ask the people, do you know which way is north? Because I need to do my prayers. And people would generally have no idea like where north is, or why am I asking where is north? So now we actually have, we have GPSs on all our phones, and we can actually, by the click of a button, we can find out which way is northeast, which is really nice. And I think we also mentioned that during the prayer, people are in a complete state of meditation, concentration. If people have any difficulties, if they get like any medical conditions, I mentioned just some of them there, if they cannot stand up, they can sit down and pray. If they cannot sit down, they can lay down and pray. If they cannot bow down, they can sit down. If they cannot make prostrations, they can sit down. They don't have to do those things. Or if you're a teenager, like we have teenagers, they get hurt in a soccer practice, they can still sit down in a chair and do their prayers. That's what my boys have done the last couple of days. They had a couple of tournaments and they injured themselves. So they stand up with us for their standing up prayer. And then when it's time to bowing down in prostration, they sit down on a chair because they got their knees hurt. So there are a lot of leeways and concessions for Muslims. If they have difficulties, they can do the best thing, the second best thing that they can. And that's totally acceptable. And also,
Tamim.
Yeah.
Oh, I'm sorry. Just really quickly, when you talk about the direction of prayer, right? And, if you get people, Muslims asking like which way is north or, northeast or whatever. One thing that happened recently, which is really wonderful in Hennepin HCMC, they actually added to all of the rooms. They went around and put a sticker on each of the walls so that people don't have to ask, if there's a Muslim in the room, they know which direction is northeast, and then they can just do their prayers without, calling the nurse and saying like, which way is northeast, right?
Yes.
So for y'all, that might be a really wonderful way of, just again, making Muslims who are in hospitals or clinics like feel right, very welcome in those spaces.
Right. Yeah, very good point.
And then,
For those of you who may not be familiar, Hennepin County Medical Center is basically in the heart of downtown Minneapolis, and they do have a large population of Muslim population. So it does make sense for them to have some kind of note in each room to let them know. But if they ever ask you, if you have one of those smartphones, which I think a lot of you probably do, there's a campus on all your smartphones. And if you have never used it, you can actually help them see that if they don't have one. But I think generally most people now know how to use those things. So it's a good suggestion. And I just quick note on what I put on the bottom about impurities is like Muslims would consider that when they're praying that the body, the clothes, and also the place of worship should be clean from impurities, which is considered to be urine, feces, or blood. If there's some dust on something, that's still okay. If they're praying on a ground, there's some dust on it, it's probably okay for Muslims to do this. But if it's any of these three, then they would have to wash the clothes or they have to wash their body to be able to pray again. So they would really appreciate if they are doing any blood draws or shots or IM shots or sub-Q shots and things like that, just to make sure to clean or wipe off the blood or put a Band-Aid on so they don't get it on their clothes. Or if they're putting any like catheters, Foley catheters and things like that, to not to get the urine on their clothes, because then they would have to wash, if not the entire clothes, they have to wash at least that part of it to be able to pray again. Okay.
We did get one other question about prayer. Are prayers always recited out loud, or can people say the prayer in their head?
No, very good question. So generally people, if they're praying by themselves, they can do it quietly, and at least quiet enough that they can hear it themselves. They can do it quiet. And if they do a congregational prayer, some prayers are louder, and then the couple in the middle of the day, the noon and the afternoon prayers are quiet. And then the evening and night, and also the morning prayers would be recited out loud in a mosque or in congregation at home. But then if they're praying at home by themselves, then they can just say it just loud enough that they can hear it themselves. It doesn't have to be any louder than that. And also it's usually quiet prayer. So it depends on each prayer. And I think I should probably mention about the 5 daily prayers, because I think Muslims have 2 different words for prayer. One is what I mentioned earlier that includes standing up, bowing down, prostrating. That is called salat, which is a formal way of how to worship God. So Muslims worship God 5 times a day. And then they have what they call dua, or supplication or invocation, which is generally translated as prayer. So they can do the supplications and what they call dua, those prayers, anytime, anywhere, free form. But these 5 daily prayers are like almost this is prescribed worship for Muslims on when to worship and how to worship. But within the prayers, then they can do an extra du'as, they can do extra their prayers on what to ask God for health and recovery and relief and all those other things they can do within this form of the prayer. Outside this, they can do many other prayers like open form prayers and also with them. Very good question. Any other questions? Okay, so we'll talk about the fasting during the month of Ramadan, which we just finished. Ramadan is a lunar month, so it comes 10 days earlier each year. So this year I came, what was it, John? April 10th, 12th? Something like that.
12th, yeah, April 12th, and I believe the last day was May 12th.
Yes, I came April 12th. So like next year, it's going to come about April 2nd or April 1st. So it comes 10 days earlier each year. So Ramadan really rotates throughout the year. I remember first when I came to the US, I came in 1990. I remember Ramadan being in a very short days. I think it was either January or February. And in Minnesota, I think it's similar in North Dakota, South Dakota, that the sun would set like at 4:30 in the winter days. I remember coming to America like, wow, it's so easy to fast in America. You can break your fast at 4:30, at 4:30 p.m. or 5 o'clock. I didn't realize at the time that in about 25 years later, it's gonna come in the middle of the summer. So like this year was actually shorter, but last few years we are fasting from about 4 o'clock in the morning, sometimes 3:30 in the morning, until about just before 9 o'clock, 8:45, 9 o'clock, which would make for a very long day. And then when it comes before the daylight savings, it'll be much shorter days also. So it kind of evens out over time. So Ramadan is usually 29 to 30 days. And Muslims will take no food or drinks from about an hour and a half or so before the sunrise, so pre-dawn, no food and drink until the sun sets. And when the sun sets, Muslims can eat and drink again. And that's open. And during the night, they can eat and drink until the next morning also. So that's open, but no eating and drinking basically when the sun is up. And also, it's mentioned in the Quran, what is the objective or purpose of fasting is to increase God consciousness, piety, righteousness, self-discipline, patience, and thankfulness. And also, generally outside the COVID times, Ramadan is a very community time also, that Muslims would get together with the community. They would invite family and friends over. They have open iftars and dinners with their neighbors. We have worked together with other churches and synagogues to have meals for people to come and have dinners together and break their fast and then learn something about Islam and Muslims and their neighbors. So and actually taking part, Ramadan dinners were organized by and a joint effort by the Muslim community and Minnesota Council of Churches. I think last time when they were able to do this, it was done to, I think, 17 or 18 different mosques throughout Minnesota. This was a really great things to have people to come in, get to know each other, have dinner together, and get to visit a mosque and so on also. Questions about Ramadan and fasting so far?
Yeah, someone asked, any suggestions on how to work best with diabetic individuals during Ramadan?
Yeah, excellent question. So here are some things that I was going to talk about is that there's a clause in Islamic teachings that necessity overrides prohibition. So generally, food would not be permissible. And if somebody's healthy, they should be fasting. But they have a necessity. They have diabetes. They have to take medications multiple times a day. They have emergency medications that they have to take. Then it's permissible to break the fast if somebody becomes severely hypoglycemic, they did not change their regimen and so on, then it's okay to break their fast because protecting one's health takes necessity over this, as long as it becomes emergency. Now, when it comes to other things like during fasting, like eye drops, ointments, inhalers, blood draws, and even flu shots and COVID vaccines, a lot of scholars have said that those things are permissible while somebody is fasting. It doesn't break the fast, as long as it's not done, as a glucose injection shot and things like that, which people generally don't do anyway. So those things would be still permissible while somebody's fasting. There are of course, some difference of opinion in certain areas because a lot of these things like inhalers and blood draws were not available at the time of Prophet, peace be upon him. So Muslims would go through, how the analogy, what does it refer to? How does it based on? That's how they do. And also just quickly about the people who are of diabetes, that it's really recommended to have a discussion with their providers before Ramadan, that they would adjust their insulin regimen. So because during the day, they would not be taking anything, right? So they have a pretty light breakfast early in the morning, maybe about 4 o'clock in the morning. There's no food during the day. And then they would have a dinner, generally like a larger meal at the sunset. So they would need to adjust their, especially if they're taking insulin, to adjust the insulin regimen so not to become hypoglycemic. I think most people would have a discussion with their providers in advance to adjust those things. If it becomes an emergency, they have some challenges, something happens, then generally it's considered that if somebody is considered to be sick and ill or sick, which has a very broad definition in Islam, they are permitted to break their fast. It's permissible to do that. Or if they go to the doctor and doctor says that, in my professional opinion, I recommend that you do not fast. You should continue your medication, what you're taking, that fasting is going to be not beneficial to your health. and then that person should take the doctor's opinion generally. Do everybody does that? Not always, but they have the leeway, they have the concession to take the opinion, and they don't have to fast. If it's a acute condition that just, for a few months or a few days, and that would go away, they can make up the fast later during a different month. If it's a chronic condition that they have to be, then they're not expected to be cured later on, then instead of each day of fasting, they would provide a meal to a needy person. So, and I think nowadays it was about, I think, $10 for each day that they would miss a fast. They would give $10 to a needy person to feed a needy person. And also for other people who have some other chronic conditions, if they have, if they have to take medications like 3 times a day, 4 times a day, there are a lot of medications that are available as long-acting formulations as once a day or, every 12 hours and so on for antibiotics, analgesics, and so on. They could check with their providers to see if it's available in a longer form so they can change it. I remember a few years ago, I had a friend, I met him at the mosque. I said, well, how is Ramadan going? He's like, well, Ramadan is going fine, but I cannot take my ibuprofen, so my back is killing me. I said, well, why don't you start taking naproxen and Aleve instead of ibuprofen? That will actually help you. Naproxen you can take twice a day instead of once a day. And then he can actually have, and then I met him later. He was like really happy that I told him that. So a lot of medications are available if they check with their providers. And I think I mentioned this about adjusting insulin regimen. And also those who are exempt from fasting is anybody who is sick. Of course, somebody not mildly, but somebody who has moderately sick, or even a severe cold could fall into that. Or pregnant or nursing mothers, somebody who's traveling, the kids who are too young or frail, elderly who cannot fast, those are all exempt from fasting. And we just finished the month of Ramadan, so this was like really relevant questions for us just recently. So questions? No questions? Okay. So quickly, 2 Islamic holidays. The first one is called Eid al-Fitr, which is the celebration right after the month of Ramadan, the festival of fast breaking. And the other one is called Eid al-Adha, which is the festival of sacrifice, which is done during the pilgrimage time. And the festival of sacrifice is really in remembrance of Prophet Abraham, peace be upon him, for his willingness to sacrifice his son for the sake of God. So Muslims really celebrate that on a yearly basis by sacrificing an animal and then feeding the needy, the neighbors, the family, and so on. And the greeting for these 2 holidays will be like Eid Mubarak or Happy Eid or Blessed Eid also. And during this time, if you have any Muslim patients or clients, if they could take time off to celebrate, they would appreciate that a lot, because Eid is as significant for Muslims as Christmas is for Christians. If they could go on a pass for a day, they would go. If they have elective surgeries, they may want to postpone it until then. And also, as part of the celebration is what's called henna. Henna is like they put these dyes on the hand and fingers, and actually can be very beautiful also, with a lot of arts and flowers and things like that on the hands that would kind of seep through the skin, and then it will eventually wear off also. So those are some of the practices for Eid celebration. Questions? John, anything to add?
No, I just say when it comes to henna and like the Eid, the holiday in general, usually like a lot of mosques, and I'm sure the mosques up there will have kind of like open houses around that time as well. So henna is like super dope. Actually, our daughter is, for our 13-year-old daughter, my wife, it's not an Islamic school or anything. She just goes to a normal school. So my wife actually got one of our friends who does henna to come in, and for all the girls, they're going to be getting henna as part of like the end of year kind of the end of year party as before summer starts. So it's really, really fun. And you can usually, mosques oftentimes have open houses, and they'll have like just henna people there, and you can go and get like some cool henna. So yeah, like I said, connecting with your local mosque is really fun, because a lot of times those those sort of holidays and cultural events are really open for anybody. So, you always have a standing invitation to go check that stuff out.
Yeah. Maybe by next Eid, because this Eid was kind of hard with a lot of COVID restrictions and everything else was kind of challenging last year and this coming Eid. So we say, inshallah, God willing, in a couple of months, we have the next Eid coming up. It don't have to be as restrict and socially distant and all those other things. So yeah, definitely, please go check it out. I think you will really enjoy it. It will be a good time to go and go with some Muslim friends.
And Tamim, and well, just to double down on what Tamim just said too, he mentioned the Taking Heart dinners as well. And we will, Islamic Resource Group, we will be up there next year for sure at the East Grand Forks Mosque to help them conduct and having like an open house Taking Heart dinner for you all. So I know it's, planning ahead a year is kind of a lot to ask, but, we'll be up there next year. So please, we would be absolutely thrilled if you join us next year at the mosque for a Taking Heart dinner.
That's great, John. Thanks for doing it, John. And also, you may want to get onto the email list with John, or at least get an email from him so he can let you know when time comes in. So quickly, we'll talk about illness in Islam. Illness, and technically anything good or bad that happens to somebody, Muslims believe that it's a test from God, that God is testing patients' faith, God is testing their perseverance, and that God is testing their commitment. And also, when there's an illness or something difficult happens to people, Muslims consider it to be a means for purification of the sin, not necessarily because of a sin, but means of purifications of sins. And Muslims are encouraged to take illness or any difficulty with patience and prayer, and also should not come as a surprise to see practicing Muslims who would be, if they're faced with major adversities or terminal diagnoses or things like that, to still be calm and composed. Because Muslims, at least I should say, practicing Muslims believe that this life is transient, this life is short and temporary, and this is just a test from God. The life and the hereafter is the eternal life. So Muslims are encouraged to have patience in this life, and then it will be rewarded better in the hereafter as part of that. So that is generally like the view of test from, that's a test from God. Muslims are, by the way, encouraged to seek cure and medicine and to whatever they can to alleviate and cure these conditions. There's actually a tradition from Prophet Muhammad, peace be upon him, that says that for every disease or every illness, God has created a cure, except for death and old age. And Muslims do believe that there is a cure for everything. And it may be that there may not be available at this point, but there's a cure for everything. So they're encouraged to seek, to do prayers and also to seek medicine as well also. So questions about, any questions about that so far? Okay. So quickly about Islamic values and injunctions, what people call Sharia, or what they call the Islamic rules about how to do guidance. There are 5 main objectives to Islamic injunctions. The first one is to protect the soul or the religion of the person. The second most important is to protect the life of the person. The next is to protect the mind or the honor of the person. Then is to protect the family or the lineage of the people. And then to protect the property or the wealth of the people. So Muslims believe that all the injunctions, all the rules and regulations in Islam has at least one of these objectives in mind, to protect people from, protect one of these aspects of people's lives: the soul, life, mind, honor, family, lineage, or property or wealth. Also, when it comes to the injunctions about what is permissible, what is not permissible, I think, as I mentioned earlier, to save someone's life, necessity overrides prohibition. Generally, something which would not be permissible for some Muslim, like for example, generally Muslims would avoid pork products, anything like porcine or pork-based products. But if somebody is sick, they're having a clot and they're in an OR, and the doctors or the providers in the OR, they have to administer heparin, which will be, porcine heparin. It's permissible to use that to save somebody's life. So to save a life, necessity overrides prohibition. And also, generally, when it comes to mother's life, the mother's life. And of course, there is in those extreme cases, which is only a binary choice. Choose between the life of the mother or life of the baby. Muslims are told to give precedence to the life of the mother over the life of the baby, because the life of the mother is an actual life, whereas the life of the baby is a potential life. And also there's a verse in the Quran that says that to save a single soul, to save a single person, it's as great as saving the entire humanity. And also the opposite of that, as also mentioned in the Quran, is that to kill an innocent person intentionally is as grave as killing the entire humanity. So even one single soul has a great value in Islam. So Muslims make every effort to save someone's life. Quickly about modesty in Islam, both men and women are encouraged to be modest in the way that they dress, the way that they behave, the way they conduct themselves. Muslim men, and of course, Muslim men and women are told to be modest in how they dress, to wear like essentially loose-fitting clothing, not showing their body, not showing basically the shape of the body. Muslim men would generally wear beards, and also sometimes they would wear religious caps. A woman would wear a hijab, like a head scarf covering the hair, as well as loose-fitting clothing, which is very similar to the way that nuns, or at least Franciscan nuns, used to dress, or they still dress, I think. It's just being modest. And also for Muslim women who are in different healthcare facilities, it's encouraged, it's recommended to put a sign at the door, because they would only put the hijab on while they're in presence of men who is not from their immediate family. So among their family members, the close family members, they don't have to wear the scarf. Among other women, they don't have to wear the scarf. So this is recommended to put a little sign at the door saying, please knock before entering. And if a man, if any male providers enters, they should knock and give them a few seconds to put the hijab on, to cover themselves before walking into the room. So that's encouraged. And also, like when it comes to physical exams or labor and delivery, a lot of Muslim women would prefer to have women-only providers whenever possible. Physicians, nursing assistants, anesthesiologists, all those other things. And then also a lot of practicing Muslims would avoid shaking hands with people of opposite gender. And if they're Muslims or non-Muslims, they would avoid having physical contact with people of opposite gender. So if you come encounter with some Muslim patients who may not want to shake hands with you, don't take it personally. It's not against you personally, just like one of the religious and cultural practices for people not to have physical contact with people of opposite gender. Questions? No questions? Okay. Children in Islam, Muslims believe that children are born sinless. When a baby is born in a Muslim family, they would whisper the call of the prayer in baby's ear, which basically says that there is no God but God. Muhammad is the messenger of God. God is great. Hasten to do good. Hasten to pray. There is no God but God, and that God is great. So they would just whisper them in a very melodic way into the ear of the baby. Circumcision is recommended for the boys, which is part of the Abrahamic tradition. And also the age of responsibility for children is considered to be at puberty. And of course, that differs at different places and different people. So Muslims believe when children reach the age of puberty, they just need to do their prayers on time and fasting and so on, to the best of their ability, of course, also.
So Tamim, if I may, I just want to throw in a quick, just a quick story here. So when it comes to that little, whispering or reciting that call to prayer in the newborn baby's ear, I was talking with a friend of mine, and that what they did is that when their baby was born, they actually told the staff, like, we just can you hand the baby to us as soon as possible, because it's really important to us that we whisper the call to prayer, that be the first thing our baby hears, right? And they didn't ask everybody to not speak. They didn't ask, you know what I mean? It wasn't like they weren't like telling people what to do. But what happened is, as the baby was being born, like the staff was just awesome. They just like, there were no problems or anything, so that they didn't need to speak. So they all remained totally silent. And then they handed the baby to mom and dad. And so the first thing that baby heard was her father's voice whispering the call to prayer in her ear. And like I said, they didn't demand or, tell everybody to keep their mouth shut, but the staff there was just so wonderful and so kind of with it that they just, like I said, they all just on their own just stayed silent. And that was just such a meaningful and profound experience for the parents.
Oh, yeah,
And so, like I said, little things like that. I mean, it may not, it's just a few seconds of silence, really, but it's so impactful for that Muslim family that everybody was cooperating like that. And it's a story that they tell all the time about the birth of their child. So like I said, all these little things like this really have a huge impact when you have Muslim patients
awesome.
or clients.
That's great care. That's awesome care provider. So that's great. Thank you. Actually, when we had our twins, we had a C-section. We had a planned C-section. So we asked for all female staff at the operating room, and they actually accommodated us. I mean, we went to the Abbott Hospital, and they actually asked for a female anesthesiologist from a different sister Alina hospital. They actually brought over if we needed one. So that was really great. I mean, that really shows that how much people care. And also, just to keep in mind that this, like what John is mentioning, is that the word of mouth travels, right? So if you're part of an institution, people feel that they are, respected and they have been taken good care of. They will tell everybody else in the community, make sure to go to this hospital because they did such a great job providing care for me. They were respectful. They provided, culturally appropriate care. They respected us. They honored us. So you will get more customers. Which, for a lot of healthcare facilities, that means a lot, not only financially, but it means that they're providing appropriate care for them. So yeah, those are really great. And something else also to keep in mind is that some Muslim families, they may want to wait until like the 7th day to name the baby. Now, sometimes they actually have a party on the 7th day if they do a circumcision and things like that. They would do the party, and during the party, they would invite the grandparents and aunts and uncles and family. They would start discussing what we should name the baby. And they will pick a name for the baby on the 7th day of birth and so on. So if you have somebody leaving on the 4th day or 5th day and they still haven't picked a name, it doesn't mean that they are detached from the baby. It just means they're going to do it later, probably. Good points. Thank you. So, and also other things quickly about diet for the Muslims. Just like with the Jewish faith, Muslims are told not to consume pork or pork byproducts. Probably the biggest challenge in healthcare is those gel caps, gelatin-covered capsules. And also for the cafeteria would be like jellos and marshmallows, like pepperoni, sausage, those things, they contain pork products. So in the older days, I don't think this is the case anymore. Insulin and heparin used to be available as porcine and bovine products. Now I think it's just only because of when they had the mad cow disease, I think they removed most of the bovine products. So I think it's only available as porcine or just synthetic. So what Muslims have, halal is equivalent to kosher. A lot of Muslims would prefer halal diet or zabiha only meat, which is prepared by the Muslims. So, even though they may not be vegetarians technically, if they go outside when there's no halal meat, they would be functional vegetarian. That they would eat meat if it's from at home or within the Muslim restaurants, but they would not eat meat outside in other parts, in other restaurants. And also just keeping in mind that in Islam, alcohol and illegal drugs which will intoxicate people, those are not permissible. And some of the cough syrups, including like Vicks, NyQuil, and those other things, they do contain a large portion of alcohol. So Muslims would avoid those. If it's like a small amount, like 0.5%, 1% or something, a lot of people consider it to be minute enough not to worry about it. But if there's alcohol in something, they'll try to avoid it if possible, when possible, if there are no other alternatives available.
We did get another question. She couldn't find her chat when you were on this part, but is avoiding eye contact with someone of the opposite gender part of Islamic faith?
Yeah, a very good question. So generally people would avoid prolonged eye contact with the people of opposite gender. This is considered to be as part of the religious practices and also part of the cultural practices. It's actually considered to be respectful I remember when I was growing up in Afghanistan, I would go talk to the principal of the school. I would ask to say, and then I have to put my head down and say, Mr. Principal, we need such and such thing, right? So it was considered to be respectful not to look at them straight in the eye. I think people are kind of adapting in America sometimes, but it's preferred not to, you can always gauge how people see this, but you can always, if not sure, if people are not looking at you straight in the eye, they don't want to shake hands with you, and don't take it personally. It might be a religious and cultural practice for them. John, do you want to add anything?
No, I don't know. Did you mention kind of like, I might have spaced out. But the one thing that I've learned to do, right, as a convert and, being in Muslim spaces, is instead of the handshake, right, hand over the heart.
Yes.
Is an equally respectful and culturally appropriate greeting. So when I'm meeting Muslim women, I just place, I say Assalamu alaikum, and I place my hand over my heart. Right, and that's as good as a handshake. But what that also does is it ties up my hand, because it's a reflex, right? For many of us, just to, professionally, you meet somebody, hey, stick your hand out. So when I place my hand over my heart, that just kind of, ties up my hand so I don't embarrass myself or embarrass the other person. If she doesn't want to shake my hand, that's, kind of an awkward situation. So hand over the heart is an equally appropriate gesture.
Yeah. No, good point. I mean, and also sometimes I think Muslims, if they don't want to embarrass somebody, they may want to shake hands. They might shake hands. But just remember that if you have the Muslim clients who don't want to shake hands with you, don't take it personally. Nothing against you personally. So quickly,
yeah, I don't. Yeah.
Go ahead, John.
Oh, I was going to say, yeah, nobody's going to take it personally or be offended if you do try to shake their hand, or many Muslims will just shake back just out of politeness. But what that does is just, again, it's like saying Salam Alaikum to your Muslims. It just lets them know that you get it, that you understand where they're coming from, right? And helps build that rapport. So again, those little gestures like that are just so valuable to building that relationship.
Yeah, or if you're not sure, you can ask, is it okay to shake hands? And if they say yes, then you can shake hands. And if they don't, then, I guess one of the lessons we learned from COVID is it's always better not to shake hands. With all the stuff going on, it's just better to stay away. I think that's better. But, anyways, I'm not sure how much, if you have anybody who was in hospice or end of life area. I don't want to talk too much about this if it's not part of what you have, but I'm just going to cover it quickly, is that life is considered to be sacred in Islam. No murder, suicide, euthanasia, those are not permissible. Muslims are told not to pray for death, not to rush death. And also Muslims are told that if for the terminally ill patients, a lot of scholars have said that it's not mandatory to continue life support. It's permissible if they are giving an opinion, second opinion, third opinion, that it's completely futile. It's completely hopeless. It's not going to help them. It's permissible to withdraw support based on a lot of scholars. And of course, these are very new areas. So there might be a difference of opinion about different scholars. So you may want to check with each family and person, what that means for them. But generally, a lot of scholars have said that it's permissible to withdraw support. There's a difference of opinion. What does it mean about tube feeding and TPNs and IV nutrition, things like that? But that's quickly about that part of it. So please feel free to ask me questions if you have questions about those. Abortion is permissible definitely if the mother's life is in danger. We can talk about this more if you're interested. The Muslim scholars have had this question about when does the soul enter the fetus? I mean, the spirit, the soul enter the fetus. And generally people have considered that is 120 days post-conception. So when the conception occurs 120 days post-conception, that's when God commands the soul to be blown into the body. So after 120 days, it's considered to be a human life. Now the question is not when does the life begin? Is it a human life or not? So there's a lot more restrictions after 120 days. There's a little bit more leeway before 120 days, more leniency before 40 days post-conception, but it becomes, after 120 days, it's usually if the mother's life is in danger. And also when it comes to organ and blood donations, those are recommended and also permissible and also recommended by many scholars. We have 15 minutes. I'm just going to skip over some of these things, allow you guys, we end at 3, right?
Yes, yes,
Okay,
we do.
so I'm just going to skip some of these things. You can ask me questions. We can talk about them later.
We do have a question in the chat.
Go ahead,
Yes.
John. Or
So Tina is asking, is daily shaving of body hair a cultural or religious custom for Muslim women?
it's not required that daily shaving. It's generally recommended that people would shave their I should say more specifically, sorry, like armpit hair and also pubic hair to keep it short as much as possible. So I think, once a month, every 40 days or something, try to keep it short and shave, but daily is not required. So keeping it short. I mean, if people want to do it daily, they could, but that is not a requirement. The idea is to keep it short and, not long. Good question. So just coming back quickly, I'll talk about the cases. The first case was about the neonatologist with the lung surfactant, which was porcine based. As I mentioned earlier, is that generally pork products should be avoided unless it's supposed to save someone's life, and also there is no alternative available, or the alternative is so costly, or the staff are completely not familiar with the use of that product that would actually endanger the patient's life. Then it becomes okay to use. Generally, of course, the beef-based product is permissible. The second case, which the resident could not enter the room of the patient, was because the mother or one of the family members was praying behind the door. They opened the door wasn't open, she was praying behind it. By the time they rushed back, he was done. So they could actually put a sign or refer people to go to the chapel and pray if one is available. The second one, the person who was refusing, stopped taking their antibiotics, refusing the cough syrup, missed appointments. The antibiotics was a gel caps, contained gelatin capsule. When she found out that gelatin could contain pork products, she stopped taking it. The alternative to that is that she could take antibiotics, which are tablets. They could also open up the gel caps, mix it with applesauce, chocolate, syrup, things like that. They could take it. And also maybe liquid, what's available for children in form of a suspension or liquid antibiotics, they would not contain gelatin generally. Cough syrups also contain alcohol, so she wasn't taking that. Instead of the Vicks and all those other things, Robitussin AC with codeine is a different alternative. Generally codeine is not permissible, but it's okay. And also she had missed the appointments, not because she didn't care about the appointments or she was detached from life, it's just that she didn't have a ride. She didn't have a car. Her daughter was working 2 jobs. She couldn't make it to the clinic. So that's part of it. And also a quick note to avoid using minors as interpreters, and of course family members as much as possible, if possible. If there's no alternative, of course that's what you have to use. I should also mention that, like my mother, she doesn't speak English. She's in her 70s. Whenever we want to go to a doctor, they insist on getting us an interpreter. And we know all the interpreters who speak Farsi, like Dari, personally. So it's like really awkward to have one of those things be with your doctor when you don't want to share those things. So we always say, well, can I just do the interpretation myself for my mother instead of getting somebody else that we don't want to share our medical information with them? So that is usually a challenge also. But I'll at least make sure to offer whenever it's available, professional interpreters for people. The last case, I think we talked about this briefly. She had hypoglycemia because she was diagnosed with diabetes the season before. Ramadan came, she was fasting, she didn't adjust her insulin regimen, so she had hypoglycemia. So of course you have to adjust that. And also whenever possible, and of course I'm sure all of us would do everything to accommodate people to try to provide in same gender providers whenever possible. If it's not possible, there's no female nurses available, female doctors, try to find somebody from same gender as the patient to be with the provider of opposite gender. So like, for example, if you have a Muslim woman and you only have a male doctor available, try to have a female nurse present at the same time with a doctor, so she doesn't feel alone with somebody of opposite gender. If there's no nurse, maybe a nursing assistant or somebody to be with them so she don't feel that being present with somebody of opposite gender alone, that usually helps. And also, I don't know about you guys, but those hospital gowns are not very good. I'm not sure who came up with that design, but they are not very modest. So when people refuse to wear them, they have a reason why they don't want to wear the hospital gowns. Maybe they can wear two, one on the front, one on the back to give them more privacy, or maybe get an extra sheet around to cover their lower part of their legs and also the shoulders, things like that, if at all possible. So those are some suggestions to keep in mind. Other challenges, which is not only exclusive to your Muslim patients, but would be for any patients, particularly immigrant patients, would be some of the cultural conflicts, some of the post-trauma issues. Some people may have come recently from war zones. They might be refugees. They experience some really, they may have some PTSD and things like that. They may have some language barriers. They may be able to speak English, but they may not be able to find the right words to use and how to describe how they feel. So try to listen to what they mean in addition to what they say. They may have some financial issues. They may not be able to afford the copay. They may not have a ride, afford the copay for the ride or the Uber or whatever else it is. So just keep those in mind, that not just for Muslim patients, but your general patients of other backgrounds as well. And also, here's a suggestion to keep in mind. I think one of the things I focused is that Muslims are clearly not a monolithic community. Muslims are very diverse. Some of the things that we talked about here, I would imagine even some of my cousins would not, if you go to the hospital, they probably would not wonder if there's a gelatin in a capsule or not. So it's not that you have to mention that there's gelatin, but it's something to make them feel comfortable, to say like, and it's our mission, our goal is to make you to be feel as welcome as possible. If you have any religious or cultural practices that you want us to be aware of, please let us know, and we'll try to accommodate you to the best of our ability. I think this is something really useful to offer them, so then they would feel comfortable telling you what they need, what they consider to be best for them. That would be very helpful for them. So with that, I will stop and we'll take questions from you. I hope I didn't go too fast. I know there was a lot of information to cover. So John is going to send you the PDF. At least you will have those.
Nice. All right, Danielle, do you want to ask your question? We have a hand raised.
Yes, and forgive me, it's kind of a general question. I primarily work with pediatrics, and in my adult population, I work with the Ryan White program, or HIV positive individuals. And I have several clients that are Muslim that we really, my heart goes out to them because they will not discuss their diagnosis with their family. They feel like they're going to be shunned and disassociated from their families, and that leaves them in a very, very precarious predicament when they don't have that family support for such a life-changing diagnosis. How do you handle those? Do you have any suggestions? I find myself struggling with how to support them to the best of my ability with that, knowing that a lot of the resources that they could best use are within their own families, and they don't have that.
Oh, good. That's a great question. So, the family challenges are always there. It's kind of hard to navigate through the family dynamics, because each family is different. And depending on how old the patient also is. So, it's always helpful to try to find somebody within the family that they can relate to, that it could be accepting enough that they could feel free to share with. And also, if it's possible, to find an imam. Or now I think, I'm actually doing my MDiv degree, Master of Divinity degree, to become a Muslim chaplain. I think, that is a very, new way to have Muslim professionals who are, technically clergy or imams who would be in this field, that they would not, because I would also imagine like clergy from other faiths, a lot of the Muslim clergy are not equipped, they're not skilled on how to deal with people with this kind of difficulties, like if somebody have AIDS and all those other things. So I think finding a Muslim chaplain in an area, or even if it's going to be remotely by Zoom or teleconference, might be very helpful. If you could not find a local imam who would relate to the person. But I think if you have an imam who is wise enough that he can understand the mercy of God and try to find comfort and hope for the patients, I think that would be, very helpful. And I would imagine there are a lot of Muslims, and of course, this might mean that you may want to have a discussion with the imam or the chaplain ahead of time. Let them know about these sensitivities, because they may not have dealt with this before. This might be the first case for a lot of imams. And if you could not get those, try to find a Muslim chaplain within your local network or other hospitals, maybe in Twin Cities. That would be very helpful to have somebody contact with them. John, do you want to add anything?
The one thing I would just add is sometimes it can be hard to find those folks. So again, Islamic Resource Group, that's what we do. If you're looking for a particular resource or a particular person or particular sort of qualifications within the Muslim community, we can help you find those folks. Because the reality right now is that in the state of Minnesota, we only have a very small handful of qualified Muslim chaplains. And Tamim will shortly be one of those. So if you need help finding those resources, please do contact us. We'd be happy to help.
Do you have resources available to clients that would be on the North Dakota side of the river, or does your services just end with the Red River on this side?
Mostly frankly, mostly it's Minnesota for us right now. Like I said, I do have a good relationship with the imam on the East Grand Forks side. But frankly, we're not as well connected on the North Dakota side. But if you're looking for those connections, I will track those people down for you and make sure I connect you with them.
I appreciate that. Thank you.
If it's possible to do some kind of like electronic Zoom connections or video conferencing, things like that, then distance is not an issue. Thank you.
And there was one more question in the chat from Amber I didn't want to miss out on.
Yes.
Amber was asking, I got to scroll up a little bit now, excuse me. Amber was asking, at what age should the same gender providers start? And Amber says she's thinking of pediatrics. If a brother and sister come in to see a doctor, is it okay for them to have the same family medical provider?
Yeah, good question. So when they're young enough, I think when they're like before puberty, it's okay with either gender. That doesn't make a difference. And generally, as they get older, I think the family would change. They'll try to find a same provider for a male provider for the boys and a female provider for the girls as much as possible. So as long as before puberty, before they're 10 years old to 12 years old, something like that, it usually would not make a difference. Either one is fine. But beyond that, then the family would usually try to find somebody from the same gender as much as possible. And of course, then again, I should mention that, as I mentioned earlier, is the Muslim community, again, is not a monolithic community. So with all these cases, you may want to ask your clients, your patients, your families, what can we do for you? How do you feel about this? What can we do for you to make you feel more comfortable here? And then if they go to a different provider of the same gender, of course, make sure not to take it as a personally. It's not about you. It's just that you would prefer same gender provider that somebody they can relate to. So that's part of it.
I have a question. I know it's going to vary depending on family and all of that, but what's the general consensus on disabilities, or how are they viewed as?
Religiously, there should be no stigma with disabilities. Muslims believe those are from God, and God within his ultimate infinite wisdom has decided how to test people. So religiously, there should be no stigma. There's actually a lot of concessions and a lot of ease provided with people for difficulty. People are told that when they have difficulty in this life, God would make the hereafter easy for them. People are told that when they provide care with people with difficulties, this is a great reward for them in the hereafter. So there should be no religious stigma associated with those religiously. Now, culturally, that might be something different. In certain cultures, people have those things, which is, I would imagine, even when today is 21st century America, that is the case with a lot of, broader community also, especially when it comes to a lot of mental disabilities or challenges and things like that. But religiously, there should be none of those things. Muslims are told to provide help and support for them and families, to pray for them and all those other things. So, very good question. Yeah.
I just want to chime in real quick, just with one final note, at least from my end. So Islamic Resource Group, we also provide physical resources to people, and for example, hospitals and clinics. If hospitals need copies of the Quran, right? Tamim told us, right? He was mentioning how the sacred text for Muslims is the Quran. we'd be more than happy to make sure that if you need some, we'll send you a box of Qur'ans so Muslim patients have that as a comforting resource. We also supply things like prayer rugs, hijabs if you need them, the headscarves, any sort of like Islamic kind of supplies, Islamic resource group. We can donate those to your organization to make sure that you meet the needs of your patients while they're there.
Great. We're getting a lot of, thank yous and very educational, and I would agree with that. I learned a lot today. Doing great things.
Thank you very much, everybody. I think you're going to have John's contact information. Feel free to contact us if you have any questions. We are very proud of John. We always pray for John. So please make sure to contact John if you have any questions, any resources. With phone and internet, I think we can reach out to a lot of different communities. That it doesn't have to be in Twin Cities. But so let us know. Thank you so much for organizing this. If you have any questions, let us know. I can contact John's email is there too. So thank you so much.
Thank you very much. Appreciate it. Have a good day, everybody. This should all be up by the end of today, or by the end of tomorrow, excuse me. Takes a little while for the recording to capture and all that, but I will get it put up soon. You can share it with those that couldn't come live.
Bye, everybody. Thank you very much.
Nice
Great
to
to be
meet you
with you.
guys. Thank you.